Looks like it's all coming.
All right, I believe we are live. Good afternoon. This is today is December 18th, 2020, Friday at noon. Our weekly event from United Medical ACO for our patients and for the community that we live in. Today we are going to discuss different updates from COVID and the different things that we do related to COVID and how it's changing our lives. Some of the updates that we have, I have Tanner from our business development with me, and then later on Katie is going to join me from our billing department. She's one of our client managers. Again, my name is Kemal Erkan. I'm the chairman of the United Medical ACO, and we'll start our updates. Now, I don't know if I shared this last week, but our office looks extremely nice. And right now, actually, our office is extremely loud because there's a holiday party. Since we are kind of limited, our holiday party is happening as we speak right now. So I know everyone is very happy and then a little bit loud, but it's okay. That means they're not listening either. So, so we are going to dive into the issues directly. Today, we are going to look at the COVID numbers and the vaccine update and the silver sneakers. This is from specifically mentioned to us from Humana, and then we are going to kind of look into that a little bit. And what I would like to do first is just bring my live updates from total cases so that we can kind of see where we are. All right, let's see those numbers. Okay, so this is our worldometer. Usually I don't keep them on for too long because I have to refresh anyway. So this is gonna give us, once it's working. So the nice way of looking at this efficient way is that 2 days ago numbers are there. So that was our highest day in the United States with 250,000 cases. And yesterday was another high, really high day with 237,000. And today, this is a real-time data. So as of today, it's at 36,000. This is United States. So because our home state is Delaware, so I'm going to give you our Delaware update very quickly. The numbers in Delaware also are high, on the high side. So we had the highest hospitalization in the total numbers with 407 total cases in the hospital. New hospitalization in the last 2 days between 48 and 50 in the last 2 days. And the percent of person testing positive, we are at 22.3% versus percent of tests are positive. That's a little under 10%. It's about 9.4%. So because we go through these numbers in our provider meetings, so it's now pretty much we are pretty comfortable with these numbers. Now the new positive cases at 827. This is a 10-day running average, rather. So that's, again, that's one of our highest numbers so far. So after these numbers, so I kind of did everything together. Now, I was kind of debating whether or not I should share this, honestly. And then the reason I am sharing, although it is kind of risky, just so because I do this every day, I talk to our physicians, our practices. And when you repeat something really bad every day, it's just, maybe it loses its meaning at some point. Tanner, I don't know if you kind of relate to that. So because I'm repeating it, and it's just like if I'm just saying the same thing over and over and over again. So like if it's not important anymore. But this was something that I saw on, I believe it was from New York Times, how bad the situation is. So this is December 7th, 1941. What was that day, Tanner?
Pearl Harbor.
Okay, so 2,400 people died. on September 11th, which was our worst day in this country, it was 2,977. And last week, one of those days, the total number of people who lost their lives is at 3,124. This is how bad these numbers are. So we want to make sure that people actually see this from different points, and then they can understand where we are going with this, so that we can actually make an impact in our society. Now, I'm going to actually bring Katie. She's in my conference room. I can see her from here, but we are in two different rooms. So we are going to bring her in as well. So she was one of our last minute additions because we had the holiday party. She already dressed up for Friday. Hey, Katie, how are you?
Hi, Kemal. I'm good. How are you?
Good. So from the part that I'm going to go in is the COVID-19 vaccine. And there was a survey that we completed, initially started with our providers. And then we are going to look into some of the patient portal related issues, and Katie is going to help us with those. So I'm going to actually share where we are with the survey as of last week. I believe we didn't get any new updates. So we still have this big number here where 40% of the people don't want to take the vaccine yet. Now, well, this is not a problem so far, right? Because we don't actually have the vaccine available anyway.
I can see the coronavirus, the test numbers.
The survey up. I have the survey up, so did I share the wrong place? Okay, so this happens. Let's see.
I just want to make sure we're on the same page.
Yeah, you actually, you know what? It's good that I don't have anything bad on the other screen. So here it is. So let me fix that now. This is our last survey results. Now, it's about 40% of the people who are still hesitating. So this number is big. So when we had this number in our hand, so what we have to do is we need to look into different options now. So one really important part of United Medical, and where I feel always so lucky, I think we have the best physicians, providers in our network, and then I have a very close relationship with every one of them. And when I see this issue, the first thing that I thought about was, okay, well, can we actually put a strong message out there? Because physicians are going to get vaccinated, and then they are first in line. So, and I asked them if they would be able to share their opinion on the vaccine. So I'm going to share that with you right now, first time. Okay, so where is my link? All right, so Tanner, this is never played anywhere.
No, this is the
First time. So let me make sure that I have my computer sound on. And I think I'm also competing with the Christmas music outside of my office.
We are, yes.
Which is wonderful.
I did make sure that we were okay.
Yeah. All right, so let's see if we can do a good job on our competition here. Hello, my name is Kemal Erkan. I'm the chairman of United Medical ACO. COVID-19 pandemic is a public health crisis. As of December 2020, more than 315,000 people lost their lives in the United States alone. We know that the medical science is clear. COVID-19 vaccines save lives. We understand the hesitation with the new vaccine, but who would know the answer better than our physicians? So to address this hesitation, I ask our United Medical providers the most important question for all of us. Would you take the COVID-19 vaccine? This is what they have to say.
Hello, I'm Dr. Carrie Rosal. I'm in pediatrics. Now, the vaccine has been shown to prevent severe illness from COVID. It has not killed anyone yet. And the data has been reviewed by hundreds of scientists all over the world. My life is at stake. Isn't the choice obvious? I will get the COVID vaccine.
Hello, I am Dr. Wasif Qureshi, an interventional cardiologist and director of structural heart disease with Delaware Cardiovascular Associates. I would suggest and advise all of you to talk to your primary care physicians or your physicians and go ahead and take the vaccine if you don't have any contraindications for it.
Hello everyone, my name is Gloria Diaz and this is Dr. Melendez from Complete Family Care. I just wanted to say that we are in favor of getting the COVID-19 vaccine, and we hope that our patients and that everyone takes advantage of this opportunity to get the COVID-19 vaccine. I believe it's going to save many lives, and I am confident about myself getting this COVID-19 vaccine.
Sí, hola a todos. Estamos en apoyo de la vacuna. Por favor, vacúnate.
Vacúnate.
Hello, my name is Dr. Christopher Savage. I am the founder of Brandywine Podiatry. We have 5 full-time offices in northern Delaware. We're recommending to all of our patients, our staff, and our doctors to all get the COVID-19 vaccination.
Hi, I'm Dr. Jennifer Liquido from United Medical Clinic in Smyrna. I'm a pediatrician and I have signed up to get the coronavirus vaccine once available.
My name is Dr. Ronise Barnett-Smith. I'm a family physician with United Medical Clinic. I will be getting the vaccine because I want to do what is necessary to control this deadly pandemic that is unlike anything we've seen in our lifetimes.
Hi, I'm Dr. Gail Wynn, and I'm a general surgeon, and I'm going to get vaccinated. And I'm going to get vaccinated because so far the vaccine has proven to be very effective in controlling spread of the virus by 90% or more.
Hello, my name is Dr. Erkan. I am a surgeon. My specialty is weight loss surgery or bariatric surgery. Today, I am happy to tell you that I am looking forward to get the COVID-19 vaccine as soon as it is available to me.
We have to make the right choices. It's not about whether I should be vaccinated or not, but it is our obligation for our society. This is why I will get the COVID vaccine when it's available to me. I trust you will do the same. Well, this is, actually I'm seeing the short version first time as well. So the YouTube was running on the other side, so let's not be hijacked by Trump. So, our marketing team helped with the video, and then they were able to do this very quickly. I do appreciate for their quickness, well, in a way, because this is like, it was Monday when I told them we needed this. All of our providers recorded what they had, and it's in a very short amount of time we were able to come up with what we have. I know Ethan and Tanner, they spend even more time with this, and thank you for both of them. What we are gonna do from here, why I'm sharing these, again, just so that if we can help you to understand the anxiety of the vaccine a little bit better when it's available, I think this is the right way to do what we are doing today. So with that, I just want to give you some updates from Delaware in terms of what we have, the total number of vaccines. As of December 15 from Pfizer, there's about 8,775 units available for patients for the first round. And then as Moderna just got their approval, they got the FDA advisory approval, but then the final approval, I believe it's going to either come today or sometime over the weekend. There's about 8,300 available next week from them. So the way, again, the first in line, that's about 63,000 people. And then after that, the list goes to 454,000. As we had a total of almost 974,000 people. So half will be vaccinated, hopefully, in the next couple of months. So again, we are working very closely with the state officials as well as the other places to make sure that this is going smooth for anyone who should be getting it. So now there's also this new treatment for people who have the COVID-19. This is the antibody treatment, so that it is actually for those people who are who have the symptoms, so they get the IV infusion, and then it doesn't have any major side effects, and then most effective when given in the 72 hours from the symptoms development. So if you have the onset date of, let's say today's Friday, if it started on Tuesday, it needs to be by Friday. That's like 72 hours from the time that you first felt the symptoms. So this is also available from the state. Patients who are at high risk for COVID-19 consequences, especially those over age 65, it does require a physician referral and have a positive test within the last 10 days, mild to moderate symptoms, and not eligible if they're hospitalized. That means these are the patients who are actually going through the treatment at home. And that's what we have. So you have to talk to your primary care doctor before you actually take any action with this. So then your PCP is center of your care, and you shouldn't really do anything without their knowledge. So from here, we are gonna go into our UM update, and then Tanner is gonna go through those for us.
Sure. So thanks, Kemal. This is some data that we've been continuously collecting for really since the pandemic has begun. We know we wanted to kind of really get a gauge of our patient population and how healthy they are, and making sure we're keeping track of the spread of disease around within our patient population to make sure we can mitigate it and keep it out of our offices. So as you know, we've kind of shared this for a while now, but we've been keeping track of the amount of testing we're doing within our offices. And this is looking at the last few weeks. So just looking at since maybe the end of
Sorry, go ahead.
No, that's all right. So we're looking here at just the amount of tests that are coming back negative and positive within our patient population. And as you'll see with that trend, we are trending in an upwards direction. So we're a little worried about that. With the last week still being watched, as we know, we're doing some follow-ups. We're making sure we're following up with these patients to see if there's any barriers to them getting tested, if there's any way we can help. And just making sure that our patients are following through with this. And that bottom graph is just showing the amount of orders we are actually submitting per week from each of our practices. So we have a target there of about 300 because we feel like that's a good measure to try to meet, to be able to accurately keep track of the spread of the virus within our patient population. So we're encouraging our providers to continue to test, especially as we get into the holiday season. We really want to make sure we're capturing the best data and making sure that we're prepared and we're keeping our patients safe as we get into the holiday season. So this is a little bit of a look at something that Kemal and I have had discussed in previous sessions. We really want to make sure that we are watching a particular part of our patient population that we're kind of concerned about, and that is looking at the amount of tests that might go or that are going unfulfilled. So with our red bar here, we're just looking at the positives, and we like to call this the COVID-19 positives and potential positives, because what we're seeing here with, and actually Kemal, I did add a new bar here. You'll see that with our yellow one, these are our patients that are saying that it's not needed, that we were able to get a hold of them and they let us know that they didn't feel like they needed to be tested. We are including, I kind of took a look at the data a little more, and we included a new category. So these are patients that we are unable to get a hold of. So we are doing those follow-ups. We're calling patients a number of times to make sure that they are, one, getting tested, or two, if they are unable to get tested, why might that be? Is there anything we can help with? Can we get some assistance from their practice or their provider office to see if they're still able to get tested? So this blue bar now is representing just ones that we are just unable to get a hold of. So
Which will become, those will become the not needed ones, I guess.
correct, yes.
So that's where the problem is, right here.
Yeah. And we want to make sure that we're keeping track of this to really.
So, Tanner, I just want to make sure, so then, because they can see you, now they can. The way that we have, we are explaining, so this is our second week that we are sharing this, right? So once we get the results, we put the negatives. If they're positive, you guys follow up on those patients on top of what the office does.
That's correct. Yeah, I think that's a good point to note that this is just in assistance to the provider's office.
Right, so just like the way that we are worried about, like as we are getting ready for these meetings, one of the discussions that Tanner and we had last week was, well, what happens to these people if the primary care has given them an order, and if they are not following up? One, why they're not following up? Two, what really happens to those patients, right? So that's kind of like your point on these, where they are not actually, there are people who are walking out in public maybe, and they should have been tested. So the reason we are saying this is that the awareness of these, so that people should follow up with their test, because you don't want anyone to become a super spreader. That's just very problematic for everyone. And this is, again, it's a public health crisis, right?
Correct. Yeah, and I think what we really also want to stress is, even if you are receiving a test order from your provider, there's no harm in getting the test done, even if you do feel like maybe you've gotten better. It's always good to just have the extra, from our end, to have the data, and for your end to just be able to make sure that you know everything's okay, that you're safe and healthy. So we just really want to make sure we're keeping an eye on that, and we want to stress the importance of still going through and following through with that test.
Sure.
So here I just wanted to kind of highlight that through the pandemic, United Medical here in Delaware, we've still been able to see over 400,000 patients now this year, whether a majority of that being through telemedicine, as we were able to adopt it pretty quick, get all of our practices set up, as well as, of course, still being able to perform those inpatient or in-office visits that may be still necessary. So we're proud of this number, as we're still been able to provide the same level of care, if not more so throughout the year.
All right, thank you. So now we want to be as transparent as possible with our patients. So we are sending emails to our patients for these events. So the idea is this is another channel of communication. Now, I personally send surveys either from our patient portal, or in some cases just like the regular postcards type surveys. So the reason we are sharing this, I think Tanner actually picked this one. What's so obvious here?
Well, so this is actually a more recent survey that came in. So this is a real survey that we received in the past week. And this is just one of our patients voicing some frustration with answering times, or wait times rather. It looks like trying to get a hold of an office for the clinic for an appointment or a prescription refill. So I think that this was a good one to highlight kind of what we want to get into with having patients sign up for our IQ Health portal, because we are seeing a lot of issues or some problems that patients might address within these surveys are things that we can actually help alleviate with them. And we just want to make sure that you guys are aware of the tools that we already have in place to kind of help mitigate problems that we're seeing come back in these surveys.
So the other thing that's really important here is one of the issues that we are having, we have so many phone calls, right? And we are sharing this openly with you. Now, when I look at this patient's reasoning, well, they are calling us for appointments and getting prescriptions, so on the phone. So, well, we don't do that. As of January 1, 2021, we will not be doing any refills on the phone anyway. So patient needs appointments for these. However, because for something that we shouldn't be doing, we are doing it and we get in trouble. Let me just share this. Tanner, this would kind of help for everyone to kind of understand. We have a call group, call center, And this is just one practice. This is not the ACO. Number of, now Q4 is not complete yet, but if you look at the Q3, 23,000 phone calls we are receiving. This is about like 12 provider office. So 23,000 appointments. So as I was going through this, there's a ghost here. I don't know. So as we were going through this, we wanted to kind of see what shouldn't have to be on the phone, what can be done through the patient portal.
Right.
So now in the entire year, 11 months and 10 days, it's about 80,000. Now the next one is the same, except that just the yes and no's for the reason to call. Can they be done through the patient portal? Mm-hmm. It's about 60% of these calls we are receiving should have been done through the portal. So this is why patient portal is important. Right. Now, it doesn't happen, and that's kind of one of our issues. So this is the homepage of the portal. Mm-hmm. We want every patient to get into this. So Tanner, what can they do with the patient portal?
Sure. The patient, with just here on the screenshot, we're looking at the main screen of your patient portal. So we really like to promote the patient portal because along with those wait times that you may experience having to make an appointment or request a renewal on a medication that you have, you could easily just come in here, log into your portal, and you'll see here on the left all the different things that we're going to have features available to. So if you do need to view an upcoming appointment, even, I know that that's the one that we get a lot of calls for, talk about an upcoming appointment, or reschedule an upcoming appointment. You'll see like down there towards the bottom on the left side, we have an appointments tab where you can see everything that you have upcoming. You can view information about past appointments. You can request to change an appointment or even request for a new appointment right then. Some of the other stuff with the med renewals we see on the left side here, we can not only view medications that your provider has for you, you can request for a refill right here in this medications tab. There's a number of other things you have on here. You have test results that are available. You have visit summaries that you can view. And you'll notice even now we have the COVID-19 results that are going to be uploaded to your patient portal. So this is just a really good way to stay connected with your practice, with your provider. As you even have a messaging tab there, you'll see this patient looks like they have a handful of messages waiting for them. So you can receive that patient survey that we send out right here in your portal. So that'll be an easy way to see it. You can even see up here towards the top, you can access that with the link there. But there's just so much information on here you can use. You can update your demographic information. Let's say you're moving, and instead of having to call and wait on the phone or maybe have issues reaching someone, you can just go ahead and log in and update that for you or for yourself so that your provider and your practice doesn't have to.
So they can do this through the they can do it on their phone,
right,
on their iPad,
the website,
on the computer.
download the app.
So it can be done through anything. And then now here's what happens. I just want to make sure that we have a clear message. So you need a prescription refill. You're a patient. Well, we don't just randomly prescribe something that's going to be refilled. So if there is a refill need, we have to see you. Now, for you to get that, get on the phone and then wait for 20 minutes, it's like you already know from the beginning that you are going to be waiting too long. Now, we have similar issues on the billing side. So that's why I asked Katie. Katie Needles is one of our client managers. And Katie, how long have you been with United?
I've been here for 4 years.
All right. And so now, if you can tell us, you're on the billing side of this, and you guys have similar issues. We have this on the practice side where we have these issues where patients are waiting for these types of calls. But then you have patients who are complaining about their bills, and then there are certain things can be done. Now, if you can, I'm going to share my screen. If you can actually walk us through this.
Sure. So you're pulling up the website here. So on the UMUSA website, there's that tab at the top that says for patients. You want to go to that. And we can go to patient inquiry. So just like Tanner said, in that we can go into the IQ Health patient portal, a lot of the phone calls that we were receiving could be resolved through this simple inquiry. Kamal's going through and checking the boxes here, but the first option is you can select your communication preference, whether or not you would like to receive an email communication. The next, we have a drop down and we have the reason for our inquiry. There's a variety of options there. We can pay a bill. We can update insurance information. Speaking from experience, the majority of calls that I would get would be to pay a bill, to update insurance information, or to provide a missing payment. Through this form, we can do all of those. QuickBase is the secure system that we use. So for example, Kemal, yeah, if you can go to balance dispute. So yep, you already filled it in with your information. Would you mind picking, go back to reason for inquiry for me?
Sure.
So if you do payment missing, that's a pretty frequent option that we get. Down at the bottom, there's a little checkbox where you can say proof of payment. So you can even upload a proof of payment here. If you have that snippet where Discover Card took your $35 copay out of your checking account or out of that credit card, you can upload this payment here. This drastically reduces the need to wait on hold or to leave a voicemail and have to get a call back. We do have a team of 40 representatives that do address all of these inquiries. And with this ever-changing environment, we do our best to have these calls or these inquiries done within 24 to 48 hours. Anything else you wanted to expand on in the different inquiries?
So now, Katie, this is so great, right? So we actually have this link available in the patient portal. So they don't need another, like they don't even need to go to United Medical website. So if they are utilizing, our patients are utilizing their portal, then they have links for these. So now for someone who's really just missing a payment and then they want to send us the information, for them to get on the phone, at least 10 to 15 minutes wait time, and then they're already aggravated. And then they may leave a voicemail, we may need to call them back. That's all, like the whole issue of playing phone tag is not efficient for any of us. If it's not urgent, then this is the best way to deal with these issues. Many patients, they're in meetings, they have jobs and they're not able to pick up the calls when we call them, right? So this would be a really good way for them to make this more efficient. Now, are we promoting this on the patient statements, Katie?
There is a link on the bottom of the statement for if you wanted to make a payment online. Similarly, on this inquiry screen that we were just on, if you made it all the way to the patient inquiry, you still have a chance to make that payment online. There is an option where you can say make a payment and it'll provide you that same link that is on the statements. I'll have to double check if the patient portal's on there, but it does take you to the same place.
Excellent. Well, thank you for joining us today. So we have a couple other updates and then we are gonna wrap it up after that. So now this whole issue of digital health, which is one of our kind of like signature because we were the pioneer group for telemedicine in Delaware. So we were able to, overnight, we were able to convert many of our visits to televisit in the beginning of the pandemic, helped our society to stop the spread. Now, this is really important. Now, it comes with its challenges. So I had a conference call yesterday with Humana. Humana is a Medicare Advantage plans, one of the Medicare Advantage plans. So they have shared with us that Humana patients have, and there are some other insurances that are also connected to this, but because it's given to us from Humana, I'm just gonna say it was originated from Humana, silversneakers.com. This is designed for patients. There are some stuff, so Tanner, what I see with them is that they actually have some stuff available for public, but for some you have to be an eligible patient, so you need to check your eligibility.
That's correct. And what we're looking at here right now, Kemal, actually is a lot of this information here on the right within their blog section is actually that information that they provide for the public. So any of this stuff you can get on here to their website. And I was actually reading through some of these articles earlier. It's really good information that they seem to update very regularly. So they'll have a lot of the featured blog articles that you can read, access, and share right here on their website.
Yeah, that's I checked some of them yesterday, and then that's pretty smooth, and it's also like it's good to see. Actually, by the way, Humana is going to be our guest on January 15th. They're going to be part of this meeting, so and they will get into some of the details of these and how to use it and what's available there. But I checked it out, and it's pretty cool. Now, this is from our YouTube channel. Many of these events that I have done with my team here, with my team at CRIAS and Surgery Center, and my team with the diabetes. We are putting all of them available for offline availability, so that you can actually watch them later on. It doesn't have to be on online. So it doesn't have to be live. I meant like not the online, but they're all online, but you can watch them after we finish the live sessions as well. So now next week we have only one event because of the Christmas holiday. We are off actually on Thursday and Friday. Wednesday we have the bariatric event, and this time we are going to do the bariatric event with the CRIAS practice administrator Melissa Demat and the nursing director at American Surgery Center, Michelle Ciano, and Dr. Erkan. 4 of us are going to do that, just to kind of give the perspective of the practice and the facility, so then they will be also kind of share their opinion on these. Now, I know our office today is a little bit kind of excited with the holiday party. So we are keeping our social distance. We are not in one room. We are not actually hugging each other. We are not touching each other. So it's really just like a distance, safe distance that we keep, just to kind of feel the holiday separate, that we can still, have some of those feelings that we had before pandemic. Now, Katie, this is not your first Christmas here at United Medical, so we had a lot of Christmas parties. How do you feel about what we have today?
I think it's good. I'm excited to get the food after we're done with this live webinar. So that's great. But the office is beautifully decorated. I really did appreciate that.
Well, Ann Wilson, Anna Malnikova, Barb, Susan, Terry, I don't know, and their significant others that they are abusing for these types of stuff. So they actually put a lot of time for the decoration. So I really appreciate their time and effort. So Tanner, this is your second Christmas here?
Correct. Yeah.
All right. So you don't have much to compare other than last year. So we used to have really nice holiday parties, but it's not the end of the world. So we'll still be able to put different efforts out there and then feel the joy. Next week, again, it's Christmas, and I wish everyone a Merry Christmas and Happy Holidays. I'll be back on Wednesday with Dr. Erkan and Melissa and Michelle. And after that, we'll see you after Christmas.